The senator from South Dakota.
Madam President, yesterday a letter was sent to Majority Leader Harry Reid and Minority Leader Nancy Pelosi in the House of Representatives, and I want to read just a few quotes from that letter. It says, and I quote, "When you and the President sought our support for the Affordable Care Act, you pledged that if we liked the health plans we have now, we could keep them. Sadly, that promise is under threat. Right now, unless you," directed at the Majority Leader and the Minority Leader in the House, "unless you and the Obama administration enact an equitable fix, the ACA, or the Affordable Care Act, which some of us refer to as ObamaCare, will shatter not only our hard-earned health benefits, but destroy the foundation of the 40-hour work week that is the backbone of the American middle class." The letter goes on to say, "Since the Affordable Care Act was enacted, we've been bringing our deep concerns to the administration, seeking reasonable regulatory interpretations to the statute that would help prevent the destruction of nonprofit health plans. As you know, I should say as you both know firsthand, our persuasive arguments have been disregarded and met with a stone wall by the White House and by the pertinent agencies." This is a letter that was, I said, sent yesterday to the leaders here in the House and the Senate. And I want to go on and quote just a few more passages from that letter. "We have a problem. You need to fix it. The unintended consequences of the Affordable Care Act are severe. Perverse incentives are already creating nightmare scenarios. First, the law creates an incentive for employers to keep employees' work hours below 30 hours a week. Numerous employers have begun to cut workers' hours to avoid this obligation, and many of them are doing so openly. The impact is twofold. Fewer hours means less pay, while also losing our current health benefits." The sort of summary of the letter at the end, Madam President, says, "On behalf of the millions of working men and women we represent and the families they support, we can no longer stand silent in the face of elements of the Affordable Care Act that will destroy the very health and well-being of our members, along with millions of other hard-working Americans." And so if you look at this letter and the tone of the letter, some of the things, the statements that are made here, it talks about destroying the health benefits of employees. It talks about nightmare scenarios being created by perverse incentives in the Affordable Care Act, and just goes, as I said before, if you read this, it says it will shatter, the Affordable Care Act will shatter not only our hard-earned health benefits, but destroy the foundation of the 40-hour work week that is the backbone of the American middle class. Now that letter, Madam President, if you were wondering who sent it, you might think it was coming from the National Federation of Independent Business, or perhaps the National Association of Manufacturers, the Chamber of Commerce, or some business group that obviously has major concerns and issues with the implementation of Obamacare. But that letter, Madam President, came from Mr. James Hoffa, who is the General President of the International Brotherhood of Teamsters. It was co-signed by Joseph Hansen, the International President of the UFCW, and by D. Taylor, President of Unite Here. Major union organizations, Madam President, who are very concerned about Obamacare and its implementation and what it's going to mean to the health care benefits that many of their employees, their members already enjoy, and also what it will do to wreck the 40-hour work week that is, as they describe it, the backbone of the American middle class. And so, Madam President, the list goes on of those who have deep and abiding concerns about the adverse and harmful impacts of Obamacare as it gets up to that implementation stage that we approach the first of next year. Now, as we know, last week the administration announced that they were going to delay the implementation of the employer mandate, which many of us, I think, received that news. It was welcome news because we have argued that many of the penalties that are associated with the legislation and its implementation are going to be very harmful to job creation, to economic growth in this country. that you're going to see more and more employers starting not only to not hire people, but actually to reduce the size of their workforce. And in fact, a survey of employers around the country suggested that 40% of them were in fact doing that. They were not hiring new people, and that 20% of employers in this country were actually reducing. They were laying people off because of the concerns about the mandates included in Obamacare. And so you had the administration react to that by saying, okay, listen, we've been listening to you, we hear you, we're going to delay the employer mandate. In other words, the penalty that is attached if employers don't offer a government-approved health plan with lots of bells and whistles and things in it, things that they didn't believe that they could afford. And so you get the one-year temporary relief from that. But I think the question that has to then be asked of the administration is, if you're going to provide relief from the employer mandate, what about everybody else? What about all the other Americans who are going to be impacted by this and harmed by this? What about the individual mandate, where you've got 6 million Americans who are, when it's fully implemented, going to be faced with a tax of about $1,200? You've got all kinds of families across this country who are seeing, because of the higher taxes and many of the mandates associated with the legislation, already higher premiums. In fact, when the President took office, he promised that he was going to reduce premiums for families in this country by $2,500. Well, according to the Kaiser study, and they track premiums, since the President has taken office, health insurance premiums for families in this country have actually increased by $2,500. So when the President made the argument that he would lower insurance premiums for families in this country by $2,500, just the opposite has happened. We've seen premiums actually go up. And I think premiums are going to continue to go up as this becomes implemented and becomes ultimately the law of the land. Now, a lot of my colleagues on the other side have said, well, why do you guys keep complaining about this? It is the law of the land. In fact, it is the law of the land, which I think begs the question is why the administration is not enforcing it. Why is the administration then delaying implementation of Obamacare, at least as it pertains to the employer mandate? Well, I think there are a lot of obvious reasons for that. They got tired of hearing about the adverse impacts it was having on the economy and having on jobs. We saw the jobs number from the month of June, and the number of people who had been pushed into part-time jobs was actually, in the month of June, up by 322,000 individuals. So in other words, what you're seeing is a lot of people who previously were full-time workers, want to work full-time in our economy, but are being pushed into part-time jobs. Why is that happening? Well, because at least one of the reasons I would argue is that under Obamacare, the requirements that apply to employers apply to full-time workers. So if you don't have full-time workers, and the law defines that as 30 hours a week. So if you don't have people working more than 30 hours a week, you're not covered by the mandates in the legislation. So what were many employers doing? Well, many employers were then cutting the hours of their employees to get under that 30-hour threshold so they wouldn't be hit with these costly new mandates. Well, what does that mean for the average family in this country? It means that fewer and fewer people have full-time jobs, higher take-home pay. More and more Americans are having to do part-time work, probably finding two part-time jobs to help pay the bills. That is a crushing effect on an economy that is already struggling to recover. And a lot of people, Madam President, who I would argue want to get back into the workforce, are trying to find full-time work and are being met with resistance from employers, because employers are having to deal with these costly mandates that are included in the Affordable Care Act. And so it's had, if you look at the effect, the net result so far of Obamacare, which again, we've mentioned this many times here, 2,700 pages in terms of legislation, 20,000 pages of regulations. In fact, the size of the stack of regulations is now 7.5 feet tall, so it's about a foot taller than I am. And just last week, another 606 pages of regulations were issued in terms of the implementation of this law. But can you imagine, average Americans trying to comply with 20,000 pages of regulations, or for that matter, businesses who are trying to comply with that? There is so much uncertainty associated with this law and the impact that it's going to have, and fears about the impact that it's going to have, and nothing is being done to make that any easier for most Americans. It was made easier for employers last week when the penalty for the employer mandate was delayed by a year. We believe that if you're going to delay the employer mandate for a year, you ought to delay the implementation of this law for everybody. And not just do it for a year, do it permanently. Let's start over. Let's do this the right way. It didn't take a 2,700-page bill. It didn't take 20,000 pages of new regulations. It didn't take a government takeover of 1/6 of our economy to try and solve the problems and the challenges that we have in our healthcare system today. And yet that was the solution that the President and our colleagues here, our Democrat colleagues in Congress, came up with. And as a consequence of that, we've got higher taxes, we've got higher premiums, we've got fewer jobs, and we've got lower take-home pay for many Americans. I just want to point out in terms of the issue of premiums, Madam President, that even the administration has acknowledged that some people are going to see their premiums rise under the health care reform law. There are estimates from the Society of Actuaries study that was released in 2013 that showed the state of Ohio current average cost to cover medical expenses for an individual health insurance plan to be $223. Based on the proposals submitted to the department, the average to cover those costs in 2014 under Obamacare is going to be $420, representing an increase of 88% when compared to, and this is the study of actuaries, their study. So an 88% increase in the state of Ohio, and that, of course, again, was in the individual health care market. There have been studies done that suggest that the federal health care law, the Affordable Care Act, or as I said, Obamacare, could nearly triple premiums for some young and healthy men. The premium for a relatively bare-bones policy for a 27-year-old male non-smoker in the individual market would be nearly 190% higher. And so I don't think many of the people who are going to be impacted by this have seen the full impact of this yet, but when it is fully implemented, there are going to be lots of other impacts on premiums, adverse impacts on people in this country, especially in the individual market. And as I mentioned earlier, we've already seen significant increases in premiums with regard to families. So if you look at this thing and you sort of assess where we are today, not too far, just a few months away from what's alleged to be the full implementation of this, of course now with the exception of the employer mandate, I think you can come to one very simple conclusion, and that is that the result of this has led to fewer jobs. It's led to more people being pushed into part-time work as opposed to full-time jobs, and therefore lower take-home pay for middle-class Americans. It has led to higher premiums. We're already seeing the effect of that with regard to premiums that are being paid by families and those who have to buy their insurance in the individual marketplace. We know there are lots of higher taxes in the legislation, and if you look at the impact on many people who provide health care services, the medical device manufacturers have a big tax that they're dealing with, pharmaceutical companies, health insurance plans, you can go right down the list. All of those new taxes are going to get passed on, in many cases passed on to people who are not high-income earners, but middle-class Americans who are just trying to keep their heads above water and continue to keep health insurance coverage for their families. These are the real-world impacts, Madam President, of Obamacare as we know it today. And that is why I think you see even organizations that are very sympathetic to the President, very sympathetic to his agenda, fans of his agenda, people who work very hard to get him elected into office, and the labor unions in their letter make that argument, that they work very, very hard. They walked the neighborhoods. They did all the grassroots organizing that was necessary to get the President elected. And here they are reacting to the Affordable Care Act, to Obamacare, in the same way that I think most Americans are. And that's why you consistently see public opinion polls that are very negative toward the law. In fact, there was a Rasmussen survey here just recently that said 55% of Americans disapprove of the law, 39% are in favor of it. But a significant and decisive majority of Americans believe that this is going to be bad for them bad for their own personal situation, finances when it comes to covering their families, but also bad for the economy and bad for jobs. So higher premiums, higher taxes, fewer jobs, more part-time jobs, fewer full-time jobs, lower take-home pay. That is what we today know as Obamacare. There is a better way, Madam President. We could go back and start over, do this the right way, step by step, incrementally, deal with the challenges that we have in our health care system, and there are many of them, but it didn't take a massive takeover of 1/6 of the American economy, a massive new government program, 2,700 pages in legislation, over 20,000 pages in new regulations in terms of the implementation of this to solve the challenges that we have in our health care system today. There is a better way. I hope that the feedback, if you will, the response that the President and his team are getting, not only now from those people who were opposed to it. I mean, many of us were arguing when this was being debated here in the United States Senate that this, in fact, would be the impact. We talked about the impact on premiums because of the mandates and the new taxes. We talked about the taxes. We talked about the impact on the economy and jobs and pointed out that this was going to have an adverse, harmful impact on the ability of our economy to create jobs and to get that unemployment rate down and to get people back to work in this country. Many of us were making those arguments. And many of the organizations who were opposed to the legislation were saying the same things. Well, now you have those who were actually endorsing and in favor of the legislation coming out and saying that it would shatter not only our hard-earned health benefits, but destroy the foundation of the 40-hour work week that is the backbone of the American middle class. Perverse incentives are already creating nightmare scenarios. That's what's included in the letter that was submitted yesterday to the leaders here of the Congress, written by major labor organizations in this country. These are not right-wing conservatives, right-wing Republicans who are reacting this way to Obamacare. These are allies of the President who have realized and come to the conclusion that this is incredibly problematic, not only for them and their members, the employees of a lot of companies out there with regard to the current health care benefits that they already have, but also what it means for the 40-hour work week and what it means for the take-home pay for middle-class Americans across this country. We can do better. We should do better. It's not too late, and it's never too late to do the right thing. I hope that, that as more and more of this anecdotal and empirical evidence comes forward about the implementation of this legislation, that we will do that. Madam President, I yield the floor.